Guns don't kill people. Gun owners kill people. In America, people with pre-existing mental health issues have easier access to firearms than healthcare. In 2017, 60% of gun-related deaths in America were suicides, over 23,000 in total, while 37% were murder. When we talk about the epidemic that is gun violence, there is no way presently to separate it from our conversation surrounding mental health, the safety of firearm owners, and of the public at large. Hello, Universal people. It's time for another weekly basic brief covering our top stories of the week every Friday and providing commentary related to our organization's mission of the Universal Basics. Remember to subscribe and become a member to support our team in growing the content we offer here at the People's Basics, the media home of the Universal Basics. This week, we're covering stories related to mental health and guns. Stories include mental health and violence dominating the local and state political debates in Kentucky. A California bill would incentivize behavioral health jobs, and a report finds that a workforce crisis is behind the long wait time for mental health care in Massachusetts. Furthermore, we have the Sandy Hook families able to reach a $73 million settlement with Remington Arms. Furthermore, on the anniversary of the Parkland shooting, advocates are pressuring Joe Biden to do more on gun violence. A father in Pasco County accidentally shoots his son and then turns the gun on himself. The Columbus, Ohio Mayor Ginther declares gun violence a public health crisis. Los Angeles County decides to go after financial institutions by pressuring them to freeze any transactions going for ghost gun kits. Lawmakers in D.C. reauthorize the Violence Against Women Act, but however, the boyfriend loophole has been left unaddressed. Furthermore, the Biden administration has taken the effort to try and dispute the claims in the media that his efforts for drug harm reduction that reportedly included crack pipes is false. And furthermore, a study that has been sponsored by several universities, both in America and abroad, has shown that getting the COVID-19 vaccine helps to improve people's mental health and well-being. Exposure to violent events causes trauma and lasting changes in the nervous system in both children and adults. Depression is the leading cause of disability globally, and many people live with mental illness around the world. The vast majority of people with mental illness are not violent. 95 to 97% of homicidal gun violence is not carried out by individuals with a mental illness. Depression is the leading cause of disability globally, and many people live with mental illness around the world. Dispositional factors that are predictors of violence are younger age, male sex, lower income. And contextual factors include major life changes such as divorce, unemployment, or personal victimization. Expressions of hate, rage, and threatening behavior are not mental illnesses, but are predictors of violence. Where there is a gun violence, persons with serious mental illness are significantly more likely to be the victims of violence than to be the perpetrators. However, suicide is often correlated with depression and is the number 10 cause of deaths in the adults of the nationwide population. Firearms are particularly dangerous for those with suicidal tendencies, as it has the highest lethality rate of all suicide methods. Attempts with firearms lead to deaths 82.5% of the time and constitute 50.4% of all suicide deaths in America. The second and third most common methods, suffocation and poisoning, only work roughly 62% of the time when it comes to suffocation, and poison can vary by method roughly between 1.5% and 41.5%. Guns, particularly, are pointed to as a risk for men and are the main reason that contributes to why men end up having more suicide deaths compared to women, despite women having overall higher levels of suicide attempts. What are some of the solutions that we can be addressing when it comes to mental health and gun violence? Well, first, We need to appropriately fund the Centers of Disease Control and Prevention, the CDC, to be able to do research on this. And we got to actually authorize them to consider gun violence under their purview of doing research. So they have to be looking for the causes of violent ideation and the best practices to prevent suicide and help individuals recover from trauma due to acts of gun violence in communities. We have some solutions now, but we need to keep continuing to fund the research that'll help us do better when it comes to addressing these challenges. Next, we have to provide funding and training to gun shops and shooting range employees to help identify at-risk persons. We do this already, but we need to improve our compliance across the board in these regards so that those who are considering purchasing or renting a gun are not going to be dying by suicide when they could have been detected beforehand. Although there is no single way to predict or prevent gun violence, there have been promising results using behavioral threat assessment. These approaches involve identifying those who have demonstrated, some degree of risk factors or intentions towards violence and, intervening to reduce that risk of that individual. Training school personnel in this method would likely prevent future targeted violence before it occurs. Furthermore, we have to work on creating a mechanism to allow persons with suicidal or violent ideation to voluntarily and temporarily surrender their firearms until such ideation is resolved. Enacting extreme risk protection order legislation that is time limited and provides due process would be beneficial in this regard. We could be modeling it on domestic violence restraining orders. ERPOs avoid stigmatizing people with mental illnesses because they're not focused on mental illnesses, but on the risk of gun violence. These laws, which have been shown to help prevent suicide, should focus on identifying specific high-risk behaviors instead of solely concentrating on an individual's mental health diagnoses or behavioral history. These laws also can work to refer the respondents to services, supports, and treatments that they need. Furthermore, we need to provide public education on the general importance of safe gun storage in the home, such as keeping firearms and ammunition stored separately, assuring that all firearms, including long guns, have gun locks, funding safe storage methods and research opportunities to train mental health professionals on safe storage options. We need to furthermore work to reduce the stigma of mental illness. Stigma against people with mental health concerns not only prevents people from seeking treatment, but it has also shown to affect treatment adherence. People are less willing to continue to get treatment if they have the stigma around the mental illness. Enacting public education campaigns and strongly discouraging the use of inaccurate and harmful rhetoric that blames America's gun violence problem solely on mental illness would help in these regards. Furthermore, we have to make the process of getting access to a gun harder than just the actual gun shop owner having the discretion of judging whether someone is at risk. We need to be making sure that every single person who is getting a gun needs to be going through a background check process. We urge Congress to pass bipartisan background checks to close loopholes in federal law, and which will require a background check on every gun sale or transfer with carefully defined exceptions for things like gifting to family members or for hunting or for target shooting and general self-defense. We also need to make sure that there is increased levels of collaboration across various supporting sectors for this. We need to intervene with both law enforcement, the mental health community, schools, and the general community at large. Effective prevention and intervention rely on communities for the healthy development of families and education. Mental health professionals for direct services and preventative mental health counseling, and the criminal legal system for appropriate intervention and resolution in crises. So this will do it for us here at The People's Basics. Make sure you check the description below to read up on all the other stories that we mentioned in today's basic brief. While you're down there, please leave this video a like, subscribe, and click that bell to be notified whenever a new weekly video comes out. If you want to help The People's Basics grow so we can continue to produce content advocating for the universal basics and facilitating grassroots networking for this cause, please become a Patreon member today, as well as hoping to support us through donations on top of that. The premium features we're going to be able to offer are going to grow over time thanks to supporters like you, but please check them out here on YouTube and Patreon. Thanks again for watching, and until next time, get active, Universal people.